Hello everyone, am I audible? Let me know. Audible? Am I audible? Let me check. Am I audible? Hello everyone, welcome to Unacademy Future Doctors. I myself, Dr. Dipti Kariya, I am MD PhD Physiology. I am Associate Professor and educating MBBS, MD, Nursing and Physiotherapy students. I have more than 17 years of teaching. Now, let me explain something about our subscription. We have two varieties of subscription. One that is plus subscription. Here you can choose the best from the best. You can access both live as well as recorded classes. Here you can study on the device of your choice. You can learn from India's top educators for your medical exams. You can access Question Bank, which is having more than 25,000. You can compete in the live test and quizzes. And within 12 months, we are coming with our print. Next is our iconic subscription. Here, your access to the best from two of the best. Which are these two? One that is Unacademy and Prep Ladder with Unacademy. Second that is Unacademy and Prep Ladder with Prep Ladder. Features of first one, they are well structured live batches. You can have recorded classes and all syllabus is covered. You can have question bank with more than 25,000 questions. You can have competitive live test and quiz. You can have comprehensive printed and digital notes. And second one that is Unacademy and Prep Ladder with Prep Ladder. Here you have clinical and integrated essentials, video lectures from the Dream Team, Question Bank 3 with active guidance, system tags and rapid revision, snapshots, treasures in 2021. So you can subscribe either plus or iconic subscription from your mobile. You can use my code DIPTI10 to get 10% extra discount. Longer the duration, cheaper are the rates. There are certain features which we have added in our special classes. One that is our special classes, they become interactive. You can attend live classes as well as you can participate in the live chat and get your doubts clear. Second, you can have polls for the learner. You can raise a hand in between the class to clear your doubt. You can never miss a class as you get notified for all the classes. And you can get lecture notes, you can download the lecture notes and get access to recorded sessions too. And you can attend live classes also and participate in the live chat and get your doubts clear. Another thing is we have updated and highly effective question bank. Our question bank contains more than 25,000 high-yield clinical questions. These questions, they are based on latest exam pattern. Okay? And along with that, we have also included detailed explanation for the same question. These are our NEET PG September 2021 toppers. This is our exam schedule for different months. Like I've shown, this is for December 2021. Another our Focus FMGE 2022 comprehensive batch started from 15th December for 6 months, and Target NEET PG 2022 test and discussion batch also started from December, which is the duration of 3 months. Okay, so you can subscribe either plus or iconic subscription and you can get 10% discount with my code. Now let's start with today's topic. Okay, now another more announcement for you that all the classes which we are posting, all the lectures, all the videos, live sessions, special classes, all on our channel, Unacademy Future Doctors. They all are free to access. You need not to subscribe for all these classes. Okay, so please get the maximum benefit for the same. Yeah. So today's topic is little bit difficult for students. That is pulmonary compliance. Compliance literally means distensibility. Means our lungs are distensible or not. That is measured by compliance. Okay? So compliance, for that, how to measure? We are measuring compliance by change in lung volume divided by transpulmonary, or in some of the book, intrapleural pressure. Change in lung volume per unit change in the pressure. This is the formula for compliance. Okay? Now, we are measuring two varieties of compliance. One, that is total compliance, means compliance of lungs and chest wall, because lungs are always there inside the chest cavity. We are measuring this compliance. And second one, that is compliance of lungs alone, that is pulmonary. Okay? Now, here, this is always compliance of lungs and chest wall is always less. Why? Because lungs, they have tendency to recoil and chest wall has tendency to expand, and because of that total compliance is less. So as I told you, compliance means distensibility, how much your lungs are distensible, that is we are measuring by compliance. Normal value for the compliance, as I told you, when we are measuring compliance of lungs only, that is always high. How much is the value? 0.20. Try to remember these values because these are from standard textbook. Just per centimeter of water. Okay. What does it means? When we are adding this much volume, 0.22 liters, or it is written as 220 ml, there is increase in 1 centimeter of water pressure. This happens when lungs are normally distensible. This is normal compliance. Okay? If the compliance increases or decreases, both are pathological. Okay? Then normal combined total compliance of lungs and chest wall, that is equal to 0.130 liter per centimeter of water. Means when we are adding 0.130 or 130 ml air, there is increase in 1 centimeter of water. Now, how to measure total compliance? For that, ask the subject to inspire. So one, that is via, when the person or when the subject is inspiring, we have a manometer which is attached to the other side. So one side we are measuring pressure and other side we are measuring volume. So suppose person has inspired 500 ml of air. So at 500 ml, how much is the pressure that we can get? Okay, the value, because we have manometer also attached. We have the thing which measures volume. So volume is measured and one side pressure is. Okay. So this is, by this way we can measure total comp. Okay. So you can see this kind of observation we found here. This is transpulmonary pressure here, and this is change in the lung volume. You can see here, normally here this one, 0. When it is 0 at the end expiratory state, at the end expiratory state, volume is 0 and pressure is also 0. Volume is actually not 0. We have FRC volume of air, but pressure is 0. Why? Because it is the position where recoil forces of the lung one side and expanding forces of thoracic cage, both they equalize. That is your relaxation volume, this one, FRC. And you can see here During inspiration, highest pressure with maximum volume of inspiration, that is, you can see here, this is your during inspiration, that is transpulmonary pressure, this is highest one, and here during expiration the value of transpulmonary, this is maximum expiratory position. Okay, so this way we can get the compliance diagram. Now, measurement of lung compliance on, for that what we have to do is we are measuring pressure, and the pressure is intrapleural pressure. Intrapleural pressure one side, and volume, lung volume. Okay? So here the same thing, ask the person. So we cannot measure both of them simultaneously. We have to measure separately. Okay? We are measuring intrapleural pressure by some intraesophageal catheter inserting, and we are measuring this one way, and volume by the normal spirometer. And the relationship is drawn as a diagram. This is our diagram for lung compliance. Okay? Now you can see here, this diagram is known as hysteresis. Now, what is this hysteresis loop? Hysteresis means, suppose whenever the value rises here, this, suppose for example, suppose we are drawing a graph, okay, and we are increasing the value from 0 to some value, okay, it reaches here, and when we are decreasing the same values, this loop should be 1. But here what happens, when we are inspiring we get this curve, when we are expiring we get, so this, both the curves are not same. Normally it should be same. So therefore it is known as hysteresis. Another thing is, whenever inspiration starts here, at the beginning of inspiration here, you can see there is steep part. Steep part means in the beginning this compliance is high, more increase in the volume with increase in the pressure. So pressure rises this much, volume increases. Steep part. And at the end, this now becoming flat part. So compliance is not increasing much. Same is true here during expiration also. Initially you can see here there is flat part at the onset of expiration, and at the end of expiration there is a steep part here. Okay, now another important thing, what is this hysteresis? So hysteresis means lung volume at any given pressure that is more during expiration. For example, suppose we are taking this pressure. For example, first of all, here when we are drawing this, we are keeping pressures here -5 centimeter of water intrapleural pressure, then -6, -7, -8. Sorry, here -7, -8, 7.5. So what happens here, when this loop is going up here, the pressure rises in this fashion, and the volume is here, it starts from 0, 50 and 500. So this is our tidal volume, 500 ml. So this way we can draw this. Okay? You can see here, beginning of inspiration pressure is -5, and at the end -7.5 centimeter of water. Okay? Now, so what is this hysteresis? As I told you, at the lung volume at any given pressure, suppose we are taking the pressure here 7, -7 millimeter of mercury. Okay? So at -7 millimeter of mercury, you can see the volume during inspiration lungs are holding, that is your around 300. Okay, now at the same pressure -7 centimeter of water, when lungs are expiring, how much volume is holded? Here you can see this much. 400. Okay, so always at the same pressure, volume held by the lung is more as compared to inspiration. Okay, otherwise, in other ways, how can we explain? You can see, suppose we are taking same volume, suppose 250 ml. 250 ml volume we are taking. When lungs having 250 ml volume, during inspiration, the pressure is, you can see here, this is around 6.5 centimeter of water. But at the same volume, during expiration, the pressure is less. Either you can say pressure is less or more volume is accommodated. Here, this is the curve. So, as we have discussed previously in our work of breathing, so here, lungs during this act of inspiration and expiration, during inspiration, which are the resistance lungs they have to face? Here you can see this is compliance work, this one. Okay, so resistance to overcome this compliance work, which is known as elastic resistance, we have discussed. Then next is viscous resistance, this much. And last one, this is airway resistance. So these are the resistance. Now, another is static and specific compliance. What is static compliance and specific compliance? Static compliance means what we have measured, delta V upon delta P, means change in lung volume per unit change in the transpulmonary pressure. And specific compliance is compliance at relaxation volume. Now, how much is relaxation volume we have discussed? That is FRC. If you can recall, we have discussed. This is your relaxation volume. How much? This one. So, to measure specific compliance, what we are supposed to perform, we have to measure the compliance and divide it by FRC. Okay, suppose your compliance is 0.20 only lungs per centimeter of water divided by 1200 ml. Okay? Okay, or you can say 2.2 liters. So when we are dividing this, value is 0.1 liter per centimeter of water. This is your specific compliance. Now, what is the importance of specific compliance? For example, suppose somebody is having one lung. So what happens if somebody is having one lung? In one lung, amount of volume that is accommodated is only 0.11 liter per centimeter of water, because only one lung is there, so amount is 1 liter, 0.1 liter. So how to compare it with whether that lung's compliance is normal or not? How to compare? For that, we are measuring specific. So suppose we are measuring specific compliance of one lung. What would be the value? This is static compliance, 0.11 liters per centimeter of water. And how much is FRC for one lung? 1.1 liter. So what would be your specific compliance? 0.1 liter water. Because the FRC of two lungs is your 0.2. Okay. So if it is for one lung, you will get this static and specific. Now, another advantage is we can compare this for children also, because in children you can say that FRC value and compliance both are reduced. So if we are measuring, suppose, compliance of an adult compliance is static compliance 0.22 and child's compliance is 0.11. So can you say that this is less child's compliance? No, because lungs are smaller. But if we know specific compliance, we can compare this. The factors they affect lung compliance. One, for first and foremost, that is elastic. Try to remember one thing, that is compliance is inversely proportional to surface tension. What is it? Surface means, so compliance is distensibility and surface tension tries to collapse the alveoli. So compliance tries to distend and surface tension tries to collapse. So both are opposing. So surface tension. Now, surface tension is present when there is interface, when there is air and fluid. Okay, if only fluid is there, then there is no surface tension. So for that, we have performed one experiment. In that, what we have done is, we have taken lungs outside and filled them with saline, and we have measured the compliance. So you can see this is the compliance diagram for saline filled lung. This is the compliance diagram for air filled lung. You can see here, for air filled lung, we require 3 times more pressure to expand the air filled lung as compared to saline filled, because here there is air, and when there is air, when there is interface, then there is surface tension, and surface tension increases, compliance decreases. Compliance decreases means more force is required to distend. You can see here, this is the experiment, saline filled lungs, the air filled lung. So you can see here, transpleural pressure required to expand normal lungs, that is 3 times the pressure required to expand saline filled lungs. Certain other factors, this is the same thing here. So you can see here, surface tension is responsible for 2/3 of elasticity, and remaining factors, they are for 1/3 of elasticity. Okay? Now, there are other factors which are responsible, which affect lung compliance. One, that is lung volume. As I told you, if the person is having one lung, your compliance, static compliance becomes half. Okay? So for that, what we do is, we measure specific compliance. Second is phase of respiratory cycle. As I told you, compliance diagram here, this is for inspiration, and the same is different for expiration. So during inspiration, this compliance, that is less as compared to expiration. So greater during expiration. Okay? Greater means more volume is accommodated here. So if we measure delta V upon delta P here, then third, gravity effect. When we are standing at the apices, intrapleural pressure is more negative, -10. When the pressure is more negative, then compliance is less, because pressure is denominator. When this decreases, compliance, or the pressure is more negative, then compliance means distensibility is less. Then changes during various disease conditions, like fibrosis. When the person is having fibrosis, what happens? Fibrosis is a restrictive disease. So what happens? Lung elasticity means lungs cannot accommodate more volume. So in our equation, delta V upon delta P, the delta V is, so the whole compliance. And other is, if the normal tissues are destroyed, then also elasticity and compliance is the increased compliance, that is emphysema. What is emphysema? Here it is the disease in which normal alveolar septa, that is broken, and lungs are there like a cavity without septa. Gas exchange is affected here, but here you can see that compliance is increased. Here you can see that lungs, they can accommodate more volume without much increase in pressure, but this is not beneficial anyway. It is like we have socks and their elasticity decreases, so they are used. So increased compliance is also pathological, and decreased is also pathological. So in emphysema, compliance is increased because this normal elastic septa, they are lost. You can see here, this shows normal compliance diagram. This is emphysema, in which compliance increases and fibrosis is decreased. This is all about today's class. Question from today's class, that is lung compliance. This is lung compliance, physiological basis of increased compliance, emphysema. Ventilation perfusion ratio is left, we will discuss in detail. So this is all about today's class. Thank you. If you like the video, you can like, you can share with your friends, and you can subscribe our channel Unacademy Future.